if you've had a tubal ligation as a female, what are your options to get pregnant? And they're really twofold. One is to basically connect your tubes back together, and that requires major surgery. We do an incision that looks like a C-section incision. We go in and reconnect the tubes that have been separated. So it can work, but it's major surgery. It can leave the tubes scarred where they stay occluded and the surgery hasn't helped at all, or the tubes can be narrowed, and while you might get pregnant, the embryo can get stuck going through this narrow part of the tube and lead to a tubal pregnancy. The alternative is in vitro fertilization, where you essentially say, the tubes are blocked, I'm going to leave them alone, and I'm going to bypass my tubes. I don't need my tubes. And so with IVF, you pull the egg out of the ovary, fertilize it in the petri dish, put the embryo directly in the uterus, and that way your tubes don't have to be open or connected. By putting the embryo in the uterus, you lower the risk of a tubal pregnancy because the embryo is where it should be, and IVF affords you the opportunity to screen the embryo for chromosomal issues, which you couldn't do with the surgery option. So these days, the vast majority, over 90% of patients with a tubal ligation, opt for IVF.